We prospectively analyzed clinic and out-of-clinic sympathetic activity in matched uncontrolled hypertensive patients receiving antihypertensive medications compared to true controlled hypertensive patients. Patients with matched uncontrolled hypertension has evidence of heightened out-of-clinic sympathetic activity compared with true controlled hypertensive patients, suggesting that heightened out-of-clinic sympathetic activity contributes to the development of matched uncontrolled hypertension. This is the first study to evaluate the mechanism of matched uncontrolled hypertension while study patients were out of clinic, when blood pressure levels are by definition higher, consistent with matched uncontrolled hypertension phenotype. This study was designed to compare both in-clinic and out-of-clinic sympathetic activity in patients with matched uncontrolled hypertension versus a comparator group of patients with true controlled hypertension. In-clinic sympathetic tone, as indexed by plasma catecholamine and metanephrine levels and spot urinary metanephrine levels, were similar in the two study groups. In contrast, out-of-clinic sympathetic tone, as indexed by 24-hour urinary catecholamine and metanephrine levels, were significantly higher in matched uncontrolled hypertensive patients compared to the comparator patients with true controlled hypertension. Differences in out-of-clinic sympathetic tone persisted after multiple linear regression adjustment for diabetes, BMI, smoking, and use of sympatholytic medications for catecholamines and metanephrines. Similarly, higher out-of-clinic sympathetic tone, as was evidenced by higher blood pressure variability and lower heart rate variability, is seen in matched uncontrolled hypertensive patients compared to patients with true controlled hypertension. Differences in out-of-clinic sympathetic tone persisted after multiple linear regression adjustment for diabetes, BMI, smoking, and use of sympatholytic medications for blood pressure variability and heart rate variability. These findings provide evidence of increased out-of-clinic sympathetic output as an important cause of matched uncontrolled hypertension. If confirmed, our findings suggest that treatment of matched uncontrolled hypertension may preferentially benefit from medications or interventional procedures that effectively target sympathetic output.